later in the programme. But for the moment, let's speak to Stephen Dalton, who is CEO of the Mental Health Network of the NHS Confederation. So effectively, Stephen, you represent the people who provide mental health services, is that right?
That's right, yes. Good morning.
Yeah. Well, then, what would you say about what you've been hearing? I mean, have you got the resources? Have they been cut? Are they being misdirected? How are they being allocated? What do you have to say?
Well, I guess the first thing I'd want to say is that this is a very distressing and gloomy story. But I think we do need to remember that every day our staff on the front line are working with people, both in the community and in hospital, delivering fabulous care a lot of the time that improves and saves lives. So I don't think we want to.
Yeah, to be fair enough, I shouldn't be gloomy, but overwhelmingly. There's plenty of good stuff going on up there.
There is plenty of good stuff going on there, but absolutely, this has been prompted by yet another report from the independent group, the King's Fund, highly respected, which exposes the yawning gap between the rhetoric and the reality when it comes to mental health policy in England.
Yeah.
I do think that we've seen in the last couple of years an upsurge in understanding, in greater acceptance, in a much more balanced public dialogue about mental health services. I think we've seen politicians from the Prime Minister to ministers and others all talking about mental health in a very positive way, and all of that is welcome. The problem is that mental health policy in England has become like a spectator sport that everybody talks about, but there's not much happening when it comes to making any difference. In fact, we're going backwards at the moment. So the contribution that we have from the Department of Health is to say that they're investing more money. Well, that may or may not be true. But if it was true, there are two things. Firstly, what might be planned absolutely isn't reaching the front line. And secondly, if this government and NHS England want investment earmarked for mental health services to get to the front line of provision, they need to stop sending it via layers of uncoordinated bureaucracy.
You don't get as we were just saying, it goes effectively to the same groups who commission everything else, doesn't it? That's the way it's allocated at the moment.
It does.
So if you're not top of their list, then you don't get the money.
Well, and what's top of their list are the things which are driven by targets and the things which are driven by political considerations.
So, you're a bit of a Cinderella still, do you think? A Cinderella service?
Well, that's a phrase which I guess some people would want to apply to our services. But, there are opportunities of doing things differently, and there are some things that we can do collectively. But the problem is that it's really very difficult to plan in an environment when services are at breaking point. And is one of the problems you haven't really got a fixed budget? You don't know what the budget is going to be. Is that where planning is difficult? I mean, if you're being allocated money by services and you don't really know what you're going to get each year, is that the problem? Well, I do think that things would be improved massively if resources for the NHS were planned over a period longer than a year. So in less than 2 weeks' time, the Chancellor, in the Comprehensive Spending Review, has an opportunity to direct money. If the policy about prioritising mental health services is an honest policy and one that they want to deliver on during this Parliament, then the Chancellor has an opportunity to direct money to the front line of mental health services, not through a bureaucracy of all sorts of commissioning arrangements where money goes missing and never actually reaches the front line. This is a political choice, and it is one that the Chancellor can give. And importantly, that those settlements need to be over a planning time frame longer than 1 year, because it's almost impossible to plan on the basis of 1 year.
Okay, thank you for that. So that's Stephen Dalton from the Mental Health Network.